Pittsburgh. Ocala's information station, 1370 WOCA. Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in this sunny Thursday morning. I hope you're doing well. You know, Robin, I can't stop thinking about that interview that Hank Whittier did with the young soldier who was wounded in Afghanistan. The projectile, I don't want to say bullet because I'll probably get it wrong. It's some other military word, I guess, that goes in there. But anyway, the young man was in here in a wheelchair, and hopefully one day he won't be. It sounded pretty optimistic when I was listening to him talk, but can you imagine? Something went right through his entire body.
Yeah, that is amazing.
Damaged his intestines, I think is what he said, his spine, which I guess they were able to fix that because it looked like he was okay with his lower legs, even though he was in a wheelchair.
Yeah.
And an artery, right? Can you just imagine? I just don't even. One day I hope we put an end to all that stuff. Even if we are able to straighten up our attitudes and stop war, we'll probably always have wounds because, well, we get into accidents, right? Even if we have every safety device put onto cars, we're still going to get into accidents. And we have two pretty ladies here. You know, I'd feel so much better if I was hurt and I came to these two ladies. I think I'd feel really good. So let's talk about this for a second. In the studio, Karen Cook is with us. She is the director of Ocala Health, Wound, and Hyperbaric Care, and that's a word I need to find. We'll find out what that is. And Joy Hall is here. She's a registered nurse and a wound care expert, so they have seen their share, I'm sure, of the things we're going to talk about. And hyperbaric oxygen therapy is one of the things we'll be speaking about, as well as, in general, the Ocala Health, Wound, and Hyperbaric Center. So good morning to Karen Cook and Joy Hall. Good morning, ladies.
Good morning.
Thank you for being on the air with us today.
Well, thank you for having us.
Is there somebody waiting right now that's wounded that needs your help? I hope not.
I think the
other people
center is perfectly staffed.
All right. Well, when you go to work, you don't know what to expect, do you?
No, it's always different. It's exciting.
Do you ever have a day when there's no wounds?
No.
No. There's always somebody wounded, right?
And if not, we could trip them.
That's like the tire repair guy putting nails in the street, right?
Yeah, I believe they do that.
Oh, no. You got a good sense of humor.
Thank you.
All right. Excellent. So I guess help me understand what hyperbaric is first, and then we'll kind of stem it from there.
Okay, hyperbaric is a systemic intermittent administration of 100% oxygen.
Okay.
And we do it under pressure. And so it would be like you were diving underwater, which is why they call it a dive.
Okay.
And they take you down 2 atmospheres plus. There's different formulas for different wounds. And the breathing in of that oxygen does marvelous things for the body, and
Really?
it really assists in wound healing. Yes, sir.
Really? And is it new?
No, it was first started in the 1900s, and then it was abandoned until 1960s when the naval military picked up the thought of it, and they used it for deep sea divers for the bends.
Okay.
So they used to call it an iron lung, but it's no longer called that. It's a clear acrylic tube shape that we slide them in on a bed and we adjust them so that they're comfortable.
Wow. Can you try to illustrate with words what you see when somebody is treated that way? Does it? I mean, can you literally see a wound healing?
It's a cumulative therapy where the body actually builds up and rejuvenates. Part of what hyperbaric does is it increases the capacity of the blood to deliver more oxygen to the tissues. The hyperbaric oxygen occurs because it's administered at 100% at the atmospheric pressures that you're at. It helps to reduce swelling.
Oh, wow.
It helps to improve blood flow because your body is like a freeway system, and sometimes we get potholes or roadblocks in our freeways, and the hyperbaric oxygen is your bloodstream has got so much oxygen that it's hyper energized, so it makes new roads around roadblocks.
Have you ever done it?
Have I ever?
Yeah, have you ever gone into it?
I have not done that. I've never wanted.
Are you
to
allowed to?
I could to try it, but I've never wanted to come to work without my makeup on.
Oh, you can't have makeup on?
No, sir.
Why? What would happen?
It's a very big safety issue.
Oh, really?
You don't go in with anything that you weren't born with or 100% cotton. We provide you clothing.
Okay, so you're not naked.
No.
You have
no.
a cotton shirt
We
on.
give you a gown.
No voyeurism.
Because
there,
didn't Michael Jackson used to have one of these
He
things?
did. Yes, he would sleep in it every night.
Wow. And what was he thinking? What did he think it would do for him, and did it do it? Did it make him younger, or?
It didn't keep him alive any longer.
No,
I can tell you that.
no.
I know some of the sports trainers and athletes are starting to come in line with what hyperbaric oxygen can do for your body.
Well, how about the people that go to sleep using just an oxygen machine, and they have that mask
yeah.
on, and then they fall asleep at night, and then they just use the machine? It's not intense like
Usually
you have.
people who go to sleep with oxygen on, their body is already compromised some way. So you and I, we're breathing 24% oxygen, and we keep our O2 sats, the amount of oxygen that's circulating in our blood is usually 96 to 99 to 100%. People who wear oxygen at night, they usually don't get to keep theirs up like that. It usually drops down in the 80s, so your body starves for oxygen. So we help them. But it's actually the atmospheric pressure from the outside of the body that makes changes in the plasma and the red blood cells that actually, if you could think of it as like a garbage truck or a food service truck that's carrying nutrition and stuff around to the body, the bigger the truck, the more room you have in the truck, the more you can carry. So when you're putting people in the tank and you're diving them to 2 atmospheres below, you're like, in a sense, making that delivery truck larger.
Oh, wow.
So you're carrying more oxygen. You're also allowing some of the other different components of the blood to pick up oxygen that don't normally do that.
I think I understand it somewhat. I think
You
I have.
are fully immersed. It's a clear. The sides of the chamber are clear sides. The patient is fully immersed in the chamber. They're not in water by any means. They're breathing just 100% oxygen. They're very comfortable there. They're there for 90 minutes. We have TVs set up. The patients can recline. They can lay down. They can take naps while they're in the chamber. We have a technician and a physician that are in the facility monitoring their treatment at all times.
We don't normally consider a surgical, like an opening surgically done as a wound. I guess it is a wound, though, right?
Any break in the skin.
So do you sometimes have people who come straight from surgery? It's not an accidental wound, but rather a
Right.
surgical wound?
If the physician realizes that the flap that they've created in certain instances, if they realize that it's compromised with blood circulation, absolutely. Absolutely.
Really?
So if a person, because I have seen people whose legs are swollen, or one leg is swollen and the other one isn't, are they a candidate for that also?
You know, there's, as with anything else in healthcare, we have to go by guidelines and standards. And some of the people that you might be mentioning have a different kind of issue going on in their body that really hyperbaric oxygen isn't what they need. We do know what they need. There's a whole formula for what you're talking about, but hyperbarics isn't part of that. So we go by guidelines or standards of care, and there's certain wounds like diabetic foot ulcers are usually a really big one. Limb salvage is really important, and it happens to be one of my passions.
What is it?
Limb salvage.
Salvage? Wow.
Okay, it sounds like you're saving somebody's limb.
Absolutely.
Yeah.
Wouldn't you like to know you could keep both of your legs?
Yeah.
It's really, I think that's probably one of the most rewarding things I see is somebody coming in, they're saying they want to amputate, and we go through our formula, and 6, 8, 10 weeks later they walk out with
Who
both
wants to
feet.
amputate? A doctor? Another doctor?
Yeah, because the wound on their foot is so bad.
Oh, wow.
We can
Wow.
we can't do it 100% of the time, but
Yeah.
mostly yes.
So insurance does restrict us to 15 indications for hyperbaric oxygen therapy. And we do follow those medical guidelines. It's not for everyone, but it is, our concept is that if a wound hasn't healed or shows any signs of healing within 10 days, you should probably be seen in a wound center. And if it hasn't completely healed in a month, we have different modalities, more aggressive wound care that we can provide to patients to aid in that healing of that wound.
And you have an awesome responsibility, Karen, because you have to make sure all of the staff is in sync, that the patients are right there, and what other things do you do in your capacity?
With mine, it's more getting it to be known, doing the community education, educating our community. We've been serving the Ocala Health Wound and Hyperbaric Center has been serving this particular community for over 17 years. We've been the only wound center that's been providing that service for that long.
Oh, wow.
And so we have experts. We have an expert, a physician panel, and all of our wound care nurses are certified, as well as our hyperbaric technicians.
So again, just going back to the interview with the young man who was wounded in Afghanistan, he had, his story was that the wound he suffered caused a couple of problems, and the doctors didn't notice the artery right away. So he had internal bleeding after they thought they fixed everything. So he literally had an internal wound. Obviously, they had to open it up and suture it back together once they found it. But could this help somebody with completely internal wounds? Is there even such a thing?
There is. People who undergo radiation therapy for cancer treatment, or sometimes when you get an infection in your jawbone, osteomyelitis is a bone infection that you can get in different areas of your body. Those are definitely indications. The soft tissue radiation necrosis, hyperbaric oxygen is the #1 gold standard treatment for that. It is the only thing that I'm aware of that actually helps angiogenesis, and angiogenesis is just genesis is always the beginning of it. Angio's the blood. So the hyperbaric oxygen actually causes the body to make new avenues for blood.
Wow.
For arteries, I'm sorry.
Wow. I never knew that. I never knew that.
So the thing with soft tissue radiation necrosis is that over time, you started the destruction of the skin and cellular level, and it just kind of grows. And as the body replaces those cells, they don't replace with the same DNA because you've altered it with the radiation.
Really?
And so it's weaker and weaker, and every time it reproduces, it doesn't happen with everybody, but it can get weaker and weaker and weaker, and then the tissue dies off. If you don't put them in hyperbaric treatment, I don't really know any other treatment that will heal that type of wound.
So I'm just going to take an aside right now. It's probably not directly associated, but I'm just wondering something. We always hear people saying you should eat whole foods because they have oxygen in them. It almost sounds like you're kind of confirming that in a way, because I've never known whether I'm listening to somebody telling me the truth or not. Obviously, if you eat a candy bar, there's probably no oxygen in it. I don't know. What's in an apple? You think there's something in there, right? So if you eat things with oxygen in them, am I going on a crazy route here?
You're speaking of something
It's not even in your which one. All right,
not even in my
But
repertoire.
nutrition is important for wound healing.
Definitely
And
is
we do
important.
advocate
Okay, so
that
let's
to our
take
patients.
my stupid avenue and take it someplace
not stupid.
sensible. Yeah.
Not stupid.
But what do you mean? If you eat wrong, you won't be able to heal right? Is that right? Or not as well?
Maybe not even at all.
Oh, really?
Well, as our population is aging, and it is, I know I get older every day.
Me too.
I know. They gave me a discount on a Wendy's coffee. Can you believe that?
Makes you wonder, doesn't it? One of the things that we lose is our sense of taste. We don't crave the foods that we did or eat the same way that we did, and I can see that even happening in myself. A lot of
You don't look that old.
Oh.
You're spending some time in that hyperbaric chamber.
I wish. Thank you very much, Larry. That was a nice compliment.
Is this widely known in the medical community? Because if someone comes to their doctor and they have a wound or their part of their body is starting to swell, are they made aware that this is in existence, or are there still some that are naive and they don't know that this is being offered?
Well, being a professional yourself, you know how it works in the business and in any industry. If there is somebody that doesn't keep up with their reading, doesn't keep up with the latest and greatest, then the nice thing about the change in our healthcare system is that our new doctors and nurse practitioners and nursing students and all of the new healthcare professionals are being taught what we call evidence-based practice. So they're going back to trials and studies and what has worked and what hasn't worked. And that's why you see all these things coming out that say, oh, don't do that. Oh, we've been doing that for 20 years and now we know that doesn't really help.
Oh, really?
So being treated through the evidence and standard of guidelines across the United States, not even just the United States, but across the world, has really brought up the standard of wound care greatly in the last 20 years. Wound care originated with actually the endostomal therapists that are, now we call them ostomy nurses, but it began in the 1970s at the Cleveland Clinic when one of the gastroenterologists that did the ostomy treatments realized that there needs to be somebody that knows how to take care of these ostomies, and from that developed into a wound care specialty. So it's a really highly specialized field. And
So a lot of times what's happening is the average wound that comes to the wound center is about 7 months old. So these patients have been through
7
different
months?
physicians.
Wow.
They have been to different clinics. And all the physicians are trying to heal this patient. But this is now a specialized, facility that's all we do and that's all we treat. And any of the comorbidities that the patient is facing with, like uncontrolled diabetes, it goes back to the primary care physician to assist with that. So we communicate, we work together with the physicians in the care of that patient, but we are the expert in the wound care.
Can you help a patient come out of a coma with the different oxygen levels? Has that ever been?
that isn't something currently that we treat. We're basically a wound care center. I've not seen any studies on that.
No, what we're seeing, the majority of what we see is, 60% of the patients that come in, these are diabetic foot ulcers, that have exhausted resources in the community. What I mean by that is they've been through different physicians, they've been through different practices. So they come to the wound center, diabetic foot ulcers, surgical wounds that aren't healing, pressure ulcers. We see a lot of pressure ulcers as well.
Venous leg ulcers are huge. It's huge all the way across the United States.
Really?
What is that? Pressure ulcers in the
Venous leg.
venous leg.
Again, the aging process makes the veins in your legs not work as well, so you get some swelling in your legs. And if it goes on for a long period of time, then your skin just kind of opens up and starts to weep the extra blood product that stays in the leg. And those are really hard wounds to heal, and they take a long time. And again, it's a recipe for healing compression.
I don't know if this is, again, an out of left field question, but how do you get that? They were doing it since 1900, so I guess this is nothing new, but how do you separate oxygen from air? How does that process happen?
Say that again?
Air is what, 24% oxygen?
Yeah.
How do you get it out? How do you separate the oxygen from the rest of it?
Well, oxygen is a medication. And we have tanks. We have a tank that's hooked up to our
So you don't worry
facility.
about it. Somebody else does it for you, right?
So
Okay.
it feeds to the chambers 100% oxygen so that the
Okay,
patient
it's probably a dumb
Wow.
question, but I just wondered how it's
No, it's a
done.
good one.
How they take that out
No
of it.
dumb questions.
No dumb questions?
We actually pipe in the 100% oxygen.
Is it cold? Is oxygen cold? No?
I think the temperature depends on the patient that's in the chamber, but some patients have experienced that they are cold in there. We provide them with blankets and that sort of stuff.
So if you can heal or prevent even an amputation caused by possibly from diabetes, that doesn't necessarily cure the diabetes, though. So they could be back to see you in a year if they don't do something about the diabetes, right?
That's why an interdisciplinary team is so important, because it's more than just healing the wound. You have to figure out, why did they get the wound in the first place? Any wound that you have, why did you get that wound? What's the underlying cause? And that's what we're experts at. We're expert investigators to figure out, why did you get this? How did it happen? How can we keep it from occurring again? And while we're figuring all that out, what are the best therapies to use on you to close the skin back up to protect you from infection?
Okay, so just to understand, I think I'm better understanding it now in the short time we've been speaking, but it sounds like if you're in a car accident and you have that kind of a wound, and you're healthy, you're going to heal normal. We don't necessarily need the hyperbaric healing that you're talking about, right? So this is for people who literally have been, for some reason, their body's not healing.
Correct.
Some kind of a wound. Even if it's well, how does a diabetic wound happen? Do they step on something and it just grows? What happens?
Diabetics, I usually try to get them to understand the disease process within themselves as thinking about driving through downtown Tampa 60 miles an hour at rush hour, and somebody has removed all the traffic lights. They no longer have any signals from their foot to their brain that say, ouch, you stepped on something, or, ooh, this feels dry. I mean, even the part of the body that tells the skin to put out moisture because it's too dry, or don't sweat so much, you're not hot, or whatever, those nerve endings get blocked so that they don't have that thought process in their brain to think, ouch, I just stubbed my toe and broke it. They don't even know that they did it. So
typically you wouldn't have an emergency room case. It's typically somebody who's been living with something for a long time.
Correct.
Yeah.
Correct.
But are there exceptions to that? Are there the now and then?
Crush injuries. Crush injuries.
Crush injuries. Okay, like working in a factory and something falls on you?
Right, exactly. And we could have a patient with workers' comp that would come to our facility with a injury that occurred with a tractor or something happened at work, that we would put them in hyperbaric oxygen therapy to salvage that limb.
And does this process affect people that are on blood thinners, like warfarin or Coumadin, because their blood is...
that does deter the wound healing process when you're on those kinds of therapies, but it doesn't affect HBO and what we would do in there. No.
HBO.
Oh, sorry, hyperbaric.
I used to like HBO. I haven't watched it in a long time.
We have that confusion out in the community that we offer HBO. Yes.
Do people have to have a prescription from their regular doctor before they come see you, or can they just come see you?
Medicare patients can self-refer themselves to the wound center. Any of your PPO plans can self-refer to the center. It's your HMOs that require referrals from your primary care physician. And we are, like I said, educating the community, educating our physicians on the services that we provide so that we receive those referrals.
Yeah, because, Robin's probably on the same track as I am right now. I'm thinking about the listener who, or maybe the wife of the listener, the husband of the listener who is saying, or listening on their behalf, saying, my husband's got this wound on his foot and he's not doing anything about it and we really need to do something. So they can't just walk right in, right? They've got to go to their own doctor first and have that doctor recommend them.
If they're not Medicare, correct.
If they're not Medicare, okay.
Correct.
Okay, so do we give them your direct phone number, or how do they get started with the process if they're relating to what you're saying and want to go get some help?
Our direct line to our appointment line for the wound center is 401-1013.
1013?
401-1013.
Okay.
Area code 352, of course.
Okay. And we've taped this, of course. Well, we're doing it right now, so it'll be online. And hopefully, if you're listening and you want to share this with somebody else, this happens a lot. Somebody will say, can you tell me what they said? And I'll say, oh, boy. You got to go online. I'm never going to remember everything. All I know is HBO is not what I thought it was. And Michael Jackson did do the hyperbaric thing. I was trying to remember if he did.
He did.
So we, what confuses me about this is that we had this and then we stopped using it because you were talking about the evidence-based therapies, right? So at one point, somebody said we need to do this back in 1900, and then someplace along the line they said, no, we don't.
Well, he did some random trials, and the way he was doing it didn't work. But when the Navy got the concept in the 1960s, when they were having an issue with divers, then that's when it came about. And some of the, for wound healing, that's just been an evolving process. So probably the last 20 years, it's gotten a lot more specialized, and wounds are being treated more and more. And they're constantly doing research in every area, but HBO is one of those. They are doing a lot of random trials right now about other things that it might help. Currently, we can't speak to those because we don't know what the evidence is going to prove, and we have to stick with what the insurance kind of tells us we have to.
I'm sorry.
Oh, have you seen children to have this treatment?
We treat It's really 16 and up. I think our youngest
Oh.
patient has been 16 years old for hyperbaric therapy, as well
wow.
as wound care. We haven't.
Pretty young.
We don't do any pediatric care.
Okay.
The question I was going to ask you is regarding the heart illness, I guess. Have you had any secondary results? Like you're treating one thing, and then somebody says, after I did that hyperbaric thing, my heart started functioning better, or my heart doctor said it improved. Have you had that kind of feedback from the patients?
The feedback that I get is that after it's all said and done, they feel better. If you increase anybody's amount of oxygen that's circulating, they're going to think better, they're going to feel better. Maybe not during the treatment time so much, but afterwards, a few weeks later, when their bodies had a chance to just normalize from the treatments, they have better blood flow.
Okay.
They get to keep their leg because their blood
Yeah,
flow is
man.
better. and
That's
They
always
get
good.
to go back
Exciting.
to their lifestyle. That's our goal, is to
Back to
limb
the lifestyle,
salvage
maybe improve it a little bit, huh?
and improve their lifestyle. Exactly.
So
Get back
this-
to whatever activities they weren't doing because of their wound.
So this is set up like a therapy session too. You just don't go one time. Like sometimes if people need physical therapy, they have to go a
Correct.
few times at a predetermined time and date. Is that what you do?
Correct. When the patient comes into the wound care center, it's an individualized care plan. So it's just specific for that patient. And we review that care plan or reassess it every 4 weeks to make any changes to that care plan and their treatment modalities that we've treated. So say we've tried something and it didn't work. We do we do wound vac therapies. We do total contact casting for offloading. So we do different therapies, and if the patient is not healing with those therapies, every 4 weeks we're changing that plan of care, or as often as we need to.
Oh.
The hyperbaric oxygen therapy is a treatment that is patients average from 40 to 60 treatments. It's a daily treatment. They're coming in Monday through Friday, our office hours, and they're being treated for 90 days on a daily basis until they are healed. And if they are to continue for more, we continue as long as they're healing and there's signs of healing in their wound.
And could this help with dementia? Because we hear sometimes the cause of dementia is lack of oxygen.
There's a lot of clinical studies on off-label usage. That's one of them. There's nothing that's been proven yet. But it's definitely something that they're working on studying.
Would it help a man remember next Saturday's Valentine's Day? Would it help him?
That's important. No one better forget.
Next Friday?
Friday.
Oh, I had to. Oh,
Friday.
Friday.
We need to get you in hyperbaric oxygen therapy.
Oh no.
Or get your sweetheart a rolling pin.
Yeah, right. Well, Karen Cook and Joy Hall, you are both a joy. What a wonderful conversation.
Thank you for
got
having us,
great
Larry.
sense of humor and helping us. It's amazing how much we can learn in a half hour. Now, the trick
Yes.
is how much do we retain
Yes.
a half hour from now?
40%.
I don't know. How much?
want to,
40%.
40%? That's probably good for me.
Larry, if I may, I want to welcome, we added 2 new physicians to our panel of physicians, and that's Dr. Ivan Susepili is his last name, and Dr. Carla Jean Joviak, and they've just joined our panel of physicians at the Wound Care Center as experts. And we are also have relocated our facility about a year ago. We are now located behind the what is that, Barnes and Nobles and Chuck E. Cheese area. Directly, it's a plaza right behind
Oh,
that.
okay. I know where you are.
okay.
Oh, I know exactly where you
Okay.
are. Okay.
Simply
the
unforgettable.
IRS.
And
You're not that far from
cheese
here.
right there.
Yeah, the IRS is in there.
We have the IRS on
The
one side and the
IRS.
center's
Oh,
on the
yeah.
other, so we're good.
okay.
We went into that IRS office. Robin had to bring a check. She owed money.
Yeah, a lot
And
of
so all she had to do was drop a check off, right? And there's a big wall that divides the normal people from the IRS people, right? And so the wall was tall enough that everybody except for me couldn't see over it. But I was just sitting there, and I was just with her, and they weren't coming out. So I said, I wonder what they're doing. There's all kinds of people waiting. So I looked over the wall. There wasn't a person over there. And then a man came in drinking coffee, and I said, hey, what you make people? And they jumped. They couldn't believe somebody was looking over the wall.
Yeah,
Yeah.
that's right. He's the Sir Lancelot. He's
Yeah.
the
Need some
savior.
oxygen over there. All right.
The knight in shining armor.
The number again is 401-1013. And did you say there was a website?
We're on the ocalahealthsystem.com
Okay,
website.
Health System, and of course that's already on our website. So go there if you need to check it out. Call us if you need that repeated. Go to Facebook or YouTube, and this video that we just made will be on there if you want to share it with somebody. Joy Hall, Karen Cook, thank you so much, ladies.
Thank you for having us.
Great stuff. We'll take a little break and we'll be right back.
Habitat for Humanity of Marion County is a ministry dedicated to improving lives by providing affordable and decent housing. Help them help others by visiting the Habitat for Humanity